Yeah, so I just first want to talk about developing an advocacy strategy. But first, I just kind of want to preface by saying that there is no right and wrong way to advocate. However, there are many best practices to consider as you kind of move through whether you're trying to influence a policy change or advocate for a specific issue or influence government. So that's kind of what Mike and I are going to share with you today, is just some of those best practices that we've learned that we find effective when we communicate to politicians or those who influence public policy. So the first things we want to kind of go over is understanding the issue, your audience, monitoring, and then of course developing the plan. So we can go to the next slide. So, before anyone can start to form an advocacy strategy, there's kind of those key things you have to kind of consider. So what I'm going to do through this slide, so what I'm going to do through this slide is just as I'm talking, because the medical assistance in dying legislation, the amendments were proposed by the federal government, I'm just going to kind of walk you just so you can understand, because this is something that CNA is currently dealing with, and that's something that we here are starting to develop our advocacy strategy, just so you can kind of understand, how we are developing it as well, to make it a little bit more meaty, I think, for you. So first is understanding the issue. So for the amendments that were made to the medical assistance in dying legislation, so we at CEA knew that they were coming. It had been in the media since last September. So we saw this, coming up, and we, sat back and said, okay, we need to be prepared for this. So, let's start the conversation and let's figure out what we need to understand first. So to really understand the issue, we went back to our members, to nurses and practitioners that work directly with medical assistance in dying. We held interviews with them, to really understand, how the current legislation impacts them, and then how proposed changes might impact them. And it was really so we could, really understand all the pros and cons. And then on top of all this, we obviously went back and we read kind of through our old reports that were done by other institutions, other practitioners, public, government. So that's really helped us to form the basis of understanding that issue. And then the other really key point is to learn all sides and positions kind of around the issue or the conversation or the policy that you're trying to influence. And this really consists of a lot of monitoring, which also kind of brings us to the last column as well, which is monitoring. And so what I've been doing, and I mean this is at an association level, so it's a little Uber to the kind of top. And in my job, I've been monitoring the House of Commons debates. So our audience is obviously the federal government, and trying to influence them to enact the changes that we want to see. So I've been monitoring what each political party has been saying, to really understand, kind of all the sides of that conversation, and then where we can kind of press and, take our foot off the gas pedal in some other areas. So that's just kind of more one extreme, but monitoring can kind of consist of, what is the media saying, the public, other associations, practitioners, and then that really helps you to understand, those key core issues. So what is it amongst everything that's happening that you want to focus in and that needs, either more persuasion or to change? And then the other piece is knowing your audience. So I think it's first taking a step back and saying, okay, who is my audience? So for me, when I look at medical assistance in dying, obviously, it's kind of a tier. So first you have our members. So for CNA, it's, the nurses that participate. Then you kind of have the patients. Then you have the federal government, which we're trying to advocate for change. And then you kind of have the general public. So this kind of taking each kind of audience your audience kind of tier and looking at each of them individually and assessing, how do they feel? How did they feel when the legislation was first implemented? How do they feel today? How do I want them to feel? When we say, this is our position, what is it that we want them to feel? Do we want them to be on board? Once you can start understanding how they feel, you can start crafting that message, and then from there finding out those ways to engage them, kind of based on how you want to move them through. So then obviously monitoring, which is always monitoring. Things change all the time. It could be, the public is influencing the change. It could be a legislative change. It could be the media that's influencing change. Your audience could possibly change their opinion. So you always want to be monitoring so that you can adapt to that change. So the next slide is the plan. So forming that advocacy plan. And the best advice that I can give when developing that plan is to be flexible. Your plan should be multifaceted and concise. So going back to when I was just talking about medical assistance in dying, and things change all the time, and you never know where the change is going to come from. So if you have a plan that's very much outlined and defined, that allows for no possible space for change, your messaging can't change, you've really defined it, but then something could happen. You have to be able to have your plan adapt to whatever it is. So I think being flexible is one of the best tips that I can give, is that things happen all the time, and you just have to be prepared to adapt. And I mean, there's instances where even at CNA, we've prepared something to the, and it's a great, we have a whole kit and all the, one-pagers, everything. And then as soon as everything is printed and all the kits are made, something happens in the media, our position changes, and we have to completely redo everything. So it's just being able to adapt.
Judith Shamian always used to say, Sarah, Judith Shamian, for colleagues who don't know, was the president of CNA and then the president of the International Council of Nurses, and was the federal chief nurse. And she always said that kind of work is like an endless boxing match where you have to be willing to get your face punched in, wipe the blood off, sit in the corner for a few minutes, and just go back and go back and go back and go back. Over and over and over. Yeah,
I know there's times, even at CNA, where, we've been prepared, we went to a meeting with a parliamentarian, and then completely got sideswiped with something. So it's just, being able to be flexible and to adapt. And again, in order to prepare for kind of, the unforeseen, even in those meetings with parliamentarians, it's also about that constant monitoring of the issue and, just being prepared by understanding and monitoring.
Sarah and I went to a meeting on climate change with the previous minister, Pettipat Taylor, and were beautifully prepared and got sideswiped by the partners we went with, who completely overtook the meeting in a way that we couldn't sort of recover, our balance very well and get our message across. So, it's just now go back again, go back on a different day.
Yeah, that's exactly what happened. So the other thing that's important, a core piece of any advocacy strategy is obviously delivering your message. So there are a few items that all advocacy messages should have. So first is the elevator pitch. And for those of you who don't know what an elevator pitch is, it's a 30 to 60 second, 1 to 3 sentence, quick, pull it out of your back pocket. These are the top line issues. It's shocking that it's so short, but it is so effective. So if there's the person who you're trying to lobby, whether that be a politician, a stakeholder, if you see them, in an elevator, in a lobby, in a coffee shop, walking down the street, you are prepared. You can pull it out and say, hi, my name is so-and-so. I just want to quickly say hi, but I also just want to let you know, and it's kind of, boom, boom, boom. Your 3 kind of lines, because sometimes that's all you have. It's just a passing hello on the street. I know there are times, we here in Ottawa have the luxury of living close to Parliament Hill. And in my riding, there's a lot of federal cabinet ministers that I see walking about. And it's come in so handy when I'm walking down the street. I'll see them, I'll see, Minister Catherine McKenna, and it's kind of, oh, hi, how are you? This is who I work for, and, this is kind of 3 things I want to talk to you about really quick, and I'll follow up with your office. But it's that top-line messaging. And then when you are developing your public policy message, it's also important to ensure that you use plain language where possible. I really can't stress this enough, and I always go by the rule that if a grade 9 student, can't understand what it is that you're trying to communicate, you have to go back to the drawing board. And I know sometimes when communicating, especially in the health sector, there are a lot of those technical terms that you can't avoid, which is fine, but where possible, really break it down, because most people, politicians, the public, sometimes the media don't understand. And I think the best example that I can give that I saw was last March when the advisory council, the interim report for the advisory council on farmer care came out. The Globe and Mail did a news article, and in the news article it said, the council recommends that Canada create an evidence-based national formulary, and then beside that they had a dash that said, or a list of covered drugs. And right there, just by adding in a list of covered drugs, you've now made it digestible for anyone who's reading it. Not everyone knows what a national formulary is. So it just, using that plain language where possible. So I think, if anything, my best advice is the KISS method. And for those of you who don't know what it is, it's just keep it simple. Where possible, keep it simple. Less is more. The plain language, just keep it simple. So the other important thing to consider anytime that you're building an advocacy strategy or trying to influence policy is building support. So the support, so we'll go to the next slide. So that support can come from coalitions with other stakeholders, the public, the media. So it's always great, and we do it here at CNA all the time. It's always one thing for me to, when I advocate, say, oh, CNA and its members, really want this specific policy to change because this is how it affects us. But it's something more if you can then turn around and say, CNA wants this change, or I want this change, but also these 10 other organizations want this change. So we often partner with, the Canadian Medical Association,
public health, schools of nursing.
Yeah, so there's so
doctors,
many, the doctors.
CNA.
Yeah, so we, Alzheimer's, diabetes, anything where there's that cross-line messaging that you can all agree upon, and it just adds more weight, urgency to whatever it is that you're trying to communicate, right? By saying it's not just me, or it's not just us, or it's not just, the nurses or the physicians, but it's all these people collectively coming together. And it puts that urgency on the politician to say, yeah, there's a movement, and the bus is leaving, and I need to jump on. So it's just kind of giving that extra oomph. And obviously getting the media involved and creating that media buzz, whether it be at a municipal, provincial, or federal level, it never hurts to send lines to the media and try to get in through there as well, and getting the public on board, whether it be through letter writing campaigns to parliamentarians, or writing into the media. When we last October, when we went kind of across country and did some of our 2019 election town halls, some of the local news outlets reached out to us and asked if they could broadcast it live, and it wasn't because CNA reached out to them, it was because the public saw our ads. The public was calling into the TV station and asking if they were going to broadcast live. So the TV station then reached out to us and said, hey, we're getting a lot of requests, can we broadcast this live? To which, of course, we said yes. So there's just ways like that where you can get out there, get that public and media support. So the next thing we want to talk about is meeting with parliamentarians, public servants, stakeholders. So before that, we have another poll question. So we'll go to the next slide. And the first question is, have you met with your local member of parliament, so your MP, or your member of legislative assembly, so your MLA or your MPP, your member of provincial parliament?
That'll be interesting.
Yeah. So it looks like there's been some engagement.
Quite a lot.
Yeah, and some...
2/3 and a third,
yeah,
sort of?
Yeah, that's interesting. And then the other question, which I'm curious about, is in what capacity have you met with, your MP, your MLA, or your MPP? Was it as a private citizen, a practitioner, a policymaker, a member of a professional association, part of an advocacy organization, or other?
So we're about 40-60 on the first one.
Yeah.
So most people have not met, which is not that unusual.
Yeah.
Oh, interesting. Advocacy organizations, eh?
Yeah, so that's great that a lot of you are meeting with them as part of other professional associations and organizations, which is great.
I mean, that's 80%.
Yeah, and then some of it's private citizens, which is great as well. Okay, perfect. That gives me a good understanding.
Interesting.
Yeah. So meeting with politicians, so in my previous life, as Claire said, I worked on Parliament Hill for a number of different ministers and MPs for close to a decade before then switching over to the association role. So I really sat on both sides of the couch. And I think the number one thing, with meeting when I was in politics, and then, stakeholders would come in, with a breadth of different issues, and they were always a little bit nervous sometimes. And I think my best advice that I could ever give here when meeting with a parliamentarian is that there is no criteria to be a parliamentarian, to be a politician. They come in all shapes and sizes. They don't have, a 40-year law background. They are really anyone. They're you, they're me, sometimes they're high school graduates. I know back in 2011 there was the famously branded McGill 5, which were all students. Some had only graduated their first year. Some hadn't even finished their first year of university. So they really are anyone. So I know sometimes going into those meetings is kind of intimidating because they are in positions of authority. But I think the best thing to remember is that you are the expert. Most of them don't have any type of background in health or health policy. So the things that they're saying oftentimes come from opinions that have been formed by people who work for their parties, but again, not always necessarily experts. So, go in, be confident you are the expert. If someone says something, that's incorrect, don't be afraid to politely correct them. It's how we all learn. And another thing too is that everyone on the call is working in kind of the health space. And prior to joining the Canadian Nurses Association, I worked for other associations, and I can tell you it is hard to get meetings with politicians because their time is so limited and valuable. However, working in a politician's office, I can say that working in the healthcare sector, you have an advantage. There were times that we always moved meetings with other associations to accommodate, nurses, physicians, first responders, people working in the health sector with the patient population, the general public. I mean, no one is going to turn down a meeting with someone advocating for health policy. It just doesn't always happen. So it is far easier, I think, for people like you and us here at CNA to get those meetings than it is for other people, say working in I don't know, coal.
The auto industry.
Yeah, the auto industry. So, you know, the door is already open, and I think it's just asking them and getting in there and not being afraid. You are the expert, you know, be confident, be prepared. But the other thing I would always suggest too is just when you're meeting with a politician, just quickly do, you know, a Google search. Find out a little bit about them, but also about their personal background. So what they did previously, you know, if you can find information on their wife, their kids, so that you can find kind of a common ground. You know, recently I met with a member of parliament, and upon, you know, just kind of quickly doing a background search, I found that his wife was a registered nurse, retired registered nurse her entire life. But I also found a news article about him, which, and I mean, the guy that I met with was 60 plus years old, but the news article was back from when he was a teenager. And he was in a severe car accident and basically was then told that he would not live. And obviously he's 60 now, sitting in front of me, and so he did live. And the kind of the common ground that I found was kind of making that personal connection. He obviously had that direct connection, you know, with nurses, with healthcare, through his wife, through his own personal experiences. So it made my job a little bit easier in, you know, pulling on that heartstring by saying, you know, you need nurses, we need to do this. And that also kind of goes into that government relations side, which is that relationship building. And obviously I went back and circled back with him for many occasions, you know, whether it's to get on a witness list for a committee study, asking him to, you know, sponsor something. So it's also that relationship building, but doing that homework is huge, and trying to find, you know, that common ground to stand on. So I think I'll stop there and kind of pass it back to Mike, because I do want to make sure we have some time for questions at the end.
Thanks very much, Sarah. I'll share with you quickly a similar example. I was doing some work with a group who wanted to, one of their goals for that year, it was a women's health group, was to increase the number of normal vaginal births, which I think basically was to reduce C-sections and a lot of intervention. And we were talking about knowing your MPs and knowing the rules and so on. And they were here in Ottawa, and when I talked about who the minister was and showed her picture, they didn't know who it was. They thought she might have been a singer, and which is okay. People don't know this, right, if you're not used to it. But that minister had just had a baby and was a breastfeeding mom. Like, you're never going to get a more sympathetic Minister of Health for a women's health issue about birth probably than the one who just had one, right? So knowing know who's in charge, know what they look like. At the University of Toronto, we actually go through pictures, almost like flashcards in our leadership program, where we say, you better know who the Prime Minister is if you walk into him in the street, or the Governor General and the Minister of Health and so on.